This is 5 minutes. On tonight's episode of 5 Minutes, we're going to talk to a 13-year-old girl who broke her back while falling out of this tree, and the technologies that were used to not only diagnose her injuries, but also to help her get back to living a normal life. It began on a sunny evening in July, when Morgan was innocently climbing a tree, when she stepped on a dead branch and fell. Tonight we have with us Morgan Myers, who 9 months ago fell 10 to 14 feet out of a tree while playing. Morgan, I understand that compression fractures occur in the vertebrae as a result from severe falls. Describe to our audience your fall and what happened immediately afterward.
Well, when I fell, I knew something was wrong because I couldn't move. I yelled for help and my brother came shortly after. Since I couldn't put any weight on my legs, they put me on a flatboard and they took me to a local hospital. When we arrived at the ER, they were ready with a backboard and a stretcher. After the results of the x-rays, they said I needed to go by ambulance to Children's Hospital in Pittsburgh. There, the doctors diagnosed me with 2 compression fractures, L2 and T12.
After being seen at a local hospital, doctors determined that Morgan needed more advanced care, so she was brought here to UPMC Children's Hospital in Pittsburgh. Here, doctors and medical staff used state-of-the-art technology to diagnose the problem and began treatment to repair her back. How did they determine this?
The doctors and nurses at Children's Hospital were very nice. I was pretty scared. I had to go through some x-rays and CT scans. It was about 3 a.m. in the morning and I was pretty tired.
Morgan, I understand this is a picture of you in the ER.
Yes, it is.
As a result of your fall, what have you learned about the technologies used to diagnose injuries such as yours?
Through my research, I've discovered many things about radiology and x-rays. Basically, an x-ray is a picture taken with x-rays that are sent through the body. Because soft tissue is less dense than bone, the x-rays pass right through. When they do this, the bone tissue absorbs the x-rays, making only the bone visible in the negative photo. X-rays are the traditional way to track bone damage. Now doctors have more advanced technologies to track the body. Radiology is not just x-rays, it is so much more. CT imaging uses x-rays in conjunction with computing algorithms to image the body. A CT is a large tube that you lay in while x-ray detectors rotate around you to produce a computer-generated cross-sectional image or tomogram. CTs can detect more subtle variations than x-rays. A more advanced CT is the spiral multi-detector CT, which utilizes 8, 16, or 64 detectors to obtain much finer detail images in a shorter exam time. This advanced technology can reduce patients' overall radiation exposure. Continuing improvements in CT technology, including scanning times and improved resolution, have increased the accuracy and utilization in medical diagnosis. Magnetic resonance imaging, or MRI, as it's more commonly called, is a device in which the patient lies in a large tube-like machine where a magnetic field is used to align the atomic nuclei in the body through radio frequencies. This information is recorded to construct an image of the scanned area of the body, providing detailed images of the brain, muscles, and other areas. Unlike CT scans or traditional X-rays, MRIs do not use ionizing radiation. One disadvantage of the MRI is that the patient has to hold still for long periods of time in a noisy, cramped space while the imaging is being performed. UPMC Children's is using a new tool to assist with this problem in the form of video goggles. The young patients can wear these goggles and watch a movie during the MRI, thus allowing the patient to remain still. One of the most promising uses of technology is the PET/CT scanner, which combines a nuclear medicine technology with a traditional CT scan. This results in a 3-dimensional image of the body, making it easier to detect cancer. These are just some of the new technologies that have been developed in the 21st century for medical imaging.
Thank you for being on 5 Minutes. We've really enjoyed hearing about all the new advancements in radiology.
Thank you, I really enjoyed it.
This is 5 Minutes.